Welcome. My name is Dr. Shane Harada, and I'm here to introduce myself, and hopefully at some point I get to know you better as well. The purpose of this video is to, again, introduce myself and the Harada method group and the Harada method adjusting style, adjusting technique, and where it's based. But before we get to all of that, I get a lot of questions as to why I chose chiropractic. And with that, there are many, many areas then of health and healing that I've studied. I graduated in 2003 from a chiropractic college in St. Louis, Missouri. So been in practice quite a number of years. While I was in school, I was also taking acupuncture and acupressure classes, very interested in Eastern philosophy and Western philosophy type of medicine. Since a very young age, my mother was involved with herbs and natural healing type modalities and so forth. So I've had extensive understanding in herbs and clinical nutrition. Since being in practice, I've assisted over 1,000 individuals personally with weight management, also tying into kinesiology, which is also known as muscle testing. I've done some extensive study in epigenetics and gene expression with a mind-body connection, energy healing, and understanding power versus force in the body. So using very gentle chiropractic techniques, because I never want to force a bone back into place, but I do want to help the body get it back into place and align it properly from a physiological standpoint to help things flow and function much better as far as joints and ranges of motions and so forth, but then understanding also the energetic connections, the mind, body, spirit connection that we have, and how to utilize those avenues or those areas or those energies, understanding them better so that we can utilize them in the healing process. So that brings me really to one of the biggest questions that I've had over in my career is, why did I choose chiropractic? Obviously involved in so many of these different realms and different areas of healing and health. That's really why I chose chiropractic, because it is a healing and understanding the healing and supporting the body in its healing and in its natural normal function, instead of trying to give it medicines or surgeries and pharmaceutical drugs and so forth, which to me is more artificial. There's a place for it, but I want to be in the health and healing realm. So let's go back a little bit. Again, as I was raised, my mother used a lot of herbs and natural things. So I learned and became very familiar with and began to love the healing process of the body. Then as I came through, high school and into college and starting into what my career would be, it really became evident through my study, through my looking at different careers, different professions, that I truly needed to be myself in the health and wellness industry. And with that, then I literally went through the phone book and I looked up every medical and healthcare practitioner that I could find, and I wrote them all out on paper. And then I went through and said, no, 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 because obviously those ones are pretty easy to choose. And then I went, maybe, 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 maybe. And when it all settled out, I came to two professions, optometry or chiropractic. So began studying and looking. And at that point, there was no internet. It was the library. So I was in the library looking up where the schools were at, how much they cost, what neighborhoods they're in, what kind of requirements, all of those things about schooling. And then it dawned on me, and this is what I tell and encourage every person who's looking at a career. This is what I encourage you to do. Find a practitioner. Find someone who is doing what you want to be doing. And that was what came to my mind. So I contacted and connected with two optometrists, and I contacted and connected with two chiropractors, and it was really easy. I just asked the receptionist, I am thinking about going into this profession, and I would like to have 15 minutes with the doctor so that I can interview and see if it's the right profession for me. Of course, that was pretty easy, and had 15 minutes with him. So when it really came down to it, there was one question. And the question was, is this profession everything that you had dreamed of or thought of or wanted it to be? And is it living up to all of your desires and expectations? As I asked the optometrist that, very thankfully, they were so gracious, and they both responded very honestly and said, no, it's not the profession that I thought it would be. And I won't go into all of the details, but you can ask me at any time and we'll go into some of those details. But the scope of practice for the optometrist is to fit a person for contacts or glasses. That's their scope of practice. And when it all came down to it, neither one of the practitioners was really happy with all of that, because when they're fitting people for glasses and contacts, they find diseases that even specialists aren't finding, because their examination and thoroughness with studying the eye, they find things. So in a nutshell, then I went and visited with chiropractors, and it came to the same question. Is this profession everything that you had thought of, dreamed of, wanted it to be? And hands down, both of them without the absolutely yes. And so obviously the follow-up question was, why? And with that, it was both of them were passionate about what they were doing, happy with their careers, and you could just see it in their faces and in their answers as they said, because I can help every person that walks through my door. It doesn't matter what kind of pain they're dealing with. I can help them. Even if it's not something that my office specializes in, or that I need to refer them to somebody that can help them further, whether that's surgery or whether that's medicine or whether that's other herbs or nutrition or acupuncture or energy work, whatever that is, they could help those individuals. And the person coming into their office felt better going out of their office than when they came in, no matter what kind of pain or situation they were involved in. And of the patients that were in pain, 9 out of 10 walked out of the office with less pain, or in many cases, feeling absolutely well walking out of the office. And that turned me really passionate to being a chiropractor, realizing that I could also incorporate all of these other aspects in healing and wellness that I mentioned before, and going into acupuncture and acupressure, going into nutrition, going into epigenetics and some of the cutting edge research. And I would always have more learning, more research to do myself that would keep me involved in bettering and becoming better at what I do. So there was always things coming out that I would be able to study, and that's exactly what it's been for me. So let's also, we have a couple minutes here, discuss a little bit more about why I didn't go into medicine and the scope of practice, as we talked about with the optometrist. But when you think about it, medicine is not healthcare. In our society in the United States, in the Western world, it has become termed healthcare. But when you really understand it, it's not at all. It's medical care. So medical care has really basically two answers: drugs or surgery. A medical doctor's license is truly the professional license to administer drugs to their patients. And without any discredit, they go through a tremendous amount of education. I believe most of them go into their profession wanting to help people. But at the end of the day, after they're in practice, they find that 90% of their time is looking up, researching, or administering drugs to their patients, figuring out what those interactions are, talking with pharmacists, talking with other professionals, and just getting better skilled at diagnosing what the disease is and then being able to administer the drug for it. And as we say, diagnose what the disease is, isn't that really the underlying reason for every medical study is to determine what name they can give the disease that their patient is dealing with. Whether it's a blood test or other form of lab test, liver panel, thyroid panel, whatever panel, to MRI, X-ray, CT scan, whether it's a biopsy, whether it's a hair analysis, stool analysis, saliva analysis, a endoscopy, a colonoscopy, doesn't matter where the camera is shining, what's going on. Every one of those tests is to help the doctor fine-tune the disease that the person is dealing with so that then they can diagnose it. And that is the first responsibility for the doctor, is to figure out what disease you have. The second responsibility then, and this is where they shine, is treating the signs and symptoms of the disease. That's their own statement. It's the American Medical Association. Treatment of the signs and symptoms of disease. It's what I have to put on my label for natural products that says, this product is not intended to treat or diagnose any disease. And that's an interesting world that we live in. Now, as we treat and diagnose the disease in the medical world, does that mean that you're treating the disease itself? The statement says, again, the treatment of the signs and symptoms of the disease. And so an aspirin takes away the headache. The headache is the sign or the symptom, because there are so many different reasons for a headache to come about. But you take an aspirin and you think, okay, got a headache. Take an aspirin and it goes away. I'm healthy. No, because what if that headache comes from a brain tumor? Didn't take away the brain tumor, didn't treat the cause, only treated the sign or the symptom. So that's, again, why I became a chiropractor, because I wanted to dig deeper. I want to get to the cause of what's going on and then be able to help a person figure out what it takes, what it requires, whether it's spiritual, mental, emotional, or physical, and how to then go about their, if you will, treatment in helping their body heal and get well. That is health. When the body is healthy, that is health. And when the body is healthy, there is no disease and there is no reason for medical interventions. That's what I love about being a chiropractor. And I am so looking forward to serving you as we now launch this Harada Method group and the Harada Method internet, getting people more aware of what the Harada Method is. And it involves all of those connections that I mentioned at the beginning. And so in the next coming weeks, years, my goal is to help you become educated in your health, what creates health, what truly is health, and how to maintain health if you have it or once you have it. That truly, I want to help you. So with that, I will see you at the next video, and we will be discussing quite a few more things over the coming weeks, months, and years. Thank you so much for joining. I love you, and I will see you soon.